Thank you, Kermit. I will try to do the introduction. Good morning, good afternoon, and good evening to you all. My name is Marty van Lieren, and I'm the program lead of the Healthy Mothers, Healthy Babies Consortium, which is hosted by the Micronutrient Forum. I'll let you know immediately that my internet connection is very bad today. So if somehow it doesn't work, then a colleague will take over from me if you can't hear me. The consortium, the Healthy Mothers, Healthy Babies Consortium, aims to drive collective action for improving maternal nutrition, and specifically to accelerate the introduction of multiple micronutrient supplementation for pregnant women in settings where diets are poor, where indicators of maternal malnutrition and low birth weight, for instance, are high. And we believe that multiple micronutrient supplementation can have a significant improvement, not only in the mother's nutrition status, but also in birth outcomes. Today is the 6th of our series of coffee and chai chats with experts around various MMS related topics. And before I introduce today's guest, I would like to quickly take you through the format of this chat. First, our guest will give a short introduction about her topic, implementation research on MMS. And during her presentation, your mics of the audience will be muted. After Kristen's introduction, we will unmute you so you can either ask questions and carry the discussion forward. You can raise your hand through the little hand in the bottom menu. You can also write a question in the chat box. So once you're called upon to speak, then please unmute yourself, ask your question, keep it short, and then mute yourself again when you're done. That will help avoid any background noise and interfering with the discussion. If you haven't done so, we would like you to write your name and organization in your Zoom window so that we can invite you to speak by name. The total time of this chat is 30 minutes if I stop talking. And we would like to make sure that everybody who is interested has a chance to participate in a discussion. So please keep it tight, be short and cooperative. If you have any technical difficulties, like I may have, please type it also in the chat and we have somebody trying to answer you. Now, today, I'm extremely pleased to welcome to this coffee and chai chat, Dr. Kristen Hurley. Kristen is associate professor at Johns Hopkins Bloomberg School of Public Health, and she also is the senior vice president of nutrition at Vitamin Angels Alliance, a US-based NGO that is concerned with global public health problems of undernutrition and is actively advocating for and supporting the introduction of MMS in the context of rigorous implementation research. Today, Kristen will speak about implementation research to support the effective introduction of MMS during pregnancy. Kristen, I'm really delighted that you have joined us at this early hour for you, and I'm looking forward to a stimulating discussion. And the floor is yours.
Thank you, and hello everybody, and thank you so much for joining, and thank you, Marty, and to the HMHB, or Healthy Mothers, Healthy Babies Consortium, for inviting me to lead today's coffee and chat. While I give my presentation, it's just a few slides. I'm going to shut off my video, but then I'll turn it back on for the chat. Okay, so the focus of today's session is implementation research, like Marty said, and specifically how it can be used to support the introduction and effective implementation and scale up of multiple micronutrient supplements for pregnant women. I'll start by reviewing just a few slides, just a handful, followed by my favorite part of these chat series, which is a conversation with you. So if you can go to so before we begin, here's a look at what we know. Poor nutrition is a major public health problem globally for women and children. MMS is a scientifically proven intervention that improves maternal health and strengthens pregnancy outcomes above and beyond that of iron folic acid. However, we also recognize that the benefits of MMS are largely dependent upon its effective introduction, implementation, and scaling. Unfortunately, we have a tool, we can use implementation research to actually inform the effective delivery of MMS or the success of MMS. So what is implementation research? Implementation research is an approach used by many in the scientific and programmatic world. Yes, sometimes it's called by different names and approaches, and is approached in slightly different ways. But for today's discussion, here's the definition I'd like to use. Basically, implementation research is a systematic approach used to understand problems related to program implementation, and then used to identify and test possible solutions in an adaptive and iterative way. So unlike clinical research, which measures health outcomes such as birth weight, for example, implementation research examines implementation outcomes such as feasibility, coverage, cost effectiveness, equity, and more. And so when looking at implementation research in the context of MMS, or multiple micronutrient supplements, the overall objectives, just broadly speaking, are 1, to inform the implementation and effective scale-up of MMS, 2, to gain operational experience around MMS delivery in the context of antenatal care services, and 3, to strengthen health systems that support MMS delivery. So to help bring it into focus, here is an example from my work at Vitamin Angels. This shows our approach at a very high level. However, it's important again to note that there are many other successful implementation research approaches used by UNICEF and others that follow a very similar pathway, but may look a little different than what I'm going to show here. But here's what I think is most important. Successful implementation really depends on local and national leadership and partnership. So as you can see on this slide, this approach includes 3 basic phases, which look linear on the slide, but in fact are often iterative and fluid, meaning that one often goes back and forth between these 3 phases. Phase 1 includes building or creating an enabling environment for MMS. For example, we often work with local partners to conduct landscape analyses, which are used to better understand the context and the stakeholders in which the intervention might be adopted, as well as support awareness raising and consensus building activities that may lead to MMS policy and program recommendations. Next is the design and testing of an implementation strategy. This often includes formative research to understand barriers and enablers to intervention, delivery, and uptake. And often it includes an evidence-based process for the co-design and testing of implementation strategies by local stakeholders. Then the third phase is the scaling of the implementation strategy, which is intended to be informed and supported by both phase 1 and phase 2. But as I mentioned, the success of this process is 100% dependent on stakeholder engagement, country-level partnership, national leadership, and their ability to build within the context of this process the enabling environment for the effective delivery and scale up of multiple micronutrient supplements. Other implementation research activities are also being conducted around the world. For example, the governments of Bangladesh, Burkina Faso, Tanzania, and Madagascar are partnering with UNICEF to introduce MMS, and even more national governments and countries are being added to this list every day. In line with WHO's recommendation, which I'll describe in a moment, UNICEF is also taking an implementation research approach with overall goals of 1, establishing a proof of concept for successful MMS introduction, 2, delivering MMS as part of antenatal care with nutrition counseling and weight gain monitoring, and 3, with a goal of improving quality of pregnancy care for all women. So as a summary, implementation research in the MMS space has started, definitely. Introduction and scaling are currently underway in at least 16 countries listed on the right hand of the screen here. And while you may still see lots of gray on this map. That I believe is about to change. As I mentioned, this list is already growing and will keep growing. New activities and partners are being added and soon will be described on the Healthy Mothers, Healthy Babies Knowledge Hub website. So be sure to bookmark that resource. So I think the link is being added to the chat right now, but basically they will be adding a new interactive map on the MMS related work in just a few weeks. So basically you'll be able to click on a country and see what work is happening there and who's doing it and things like that. So that's very exciting. As I mentioned, the list of countries is growing, and I think that's because the timing is right and things are in place. After decades of research, WHO recently released a context-specific recommendation for MMS. The guidance recommends MMS in the context of rigorous research, including implementation research, to inform introduction and scaling within the context of antenatal care. So the global policy is there. Following that recommendation, a group of international organizations released guidance for national decision makers, helping to summarize key messages from the WHO recommendation and reiterating the need for implementation research. And that's the document in the middle. And then finally, the newest development on the right is MMS, or on the right is that MMS is now on the WHO's model list of essential medicines, which is a significant step forward for procurement, supply, implementation research efforts, and ultimately for wider accessibility and use of MMS. And I believe links to these three resources are also being provided in the chat. So finally, on this last slide, I just like to share my key takeaways. First, women deserve a positive pregnancy experience. Providing MMS is absolutely critical, but isn't enough. Fortunately, the introduction of MMS provides a window of opportunity to reduce negative maternal and child outcomes, while also providing an opportunity to strengthen maternal nutrition programs. By coupling MMS introduction with system strengthening, we can improve supply chains, delivery platforms, create demand, and develop routine monitoring systems. And in each and every implementation research project that I'm part of, what I continue to hear from national governments is they firmly believe that MMS is important for pregnant women and that it needs to be coupled with a full ANC experience. Thus, I really think implementation research is so important because it allows us to use MMS as an opportunity to strengthen the entire ANC experience for pregnant women. So with that, I thank you for listening and I welcome questions, comments, reflections. I'd love to hear your experiences if you have them, but I open it up for discussion. Thank you.
Okay, so we have a question from someone in the chat. This is Pat Mahone. We run multiple micronutrient and balanced energy protein supplementation programs. Is the implementation research on continuing MMS for lactating mothers?
Right now, I think most of the implementation research is really focused on pregnancy because that's where the strongest scientific evidence is for impact. So most of the implementation research activities that I know of right now are very much focused in pregnancy. But there is a lot of talk and thinking around both the lactation period and also the preconception period. But again, both of those periods don't have the strong scientific efficacy evidence behind them that the pregnancy period does.
Okay, Christine.
Yes.
I wonder, my name is Pat McMahon. I asked that question. I won't put my video on because my connection isn't great. I suppose like, it's brilliant to see the progress that has been made in the past 12 months around WHO guidance. Like, has been a huge issue. And I think, as you've shown, since that guidance, a lot of countries are coming on board because WHO guidance actually does inform country policy. I suppose in your slide you said MMS is good, but it's not enough. We need and I suppose, seeing as we've got a win with multiple micronutrients, I suppose the next one is balanced energy protein supplementation, whereas the WHO guidance is clearly, I think we sometimes forget balanced energy protein supplementation is basically food.
Right.
And, like, there is a huge anomaly with the WHO guidelines. And I suppose our question is, is the Healthy Mothers, Healthy Babies Alliance, is it still going to focus on multiple micronutrients, or can it also shift its focus to balanced energy protein supplementation?
I might turn it. Yeah, it's a good question. I might turn that over to Marty, but I think right now they're very much focused on multiple micronutrient supplements, but very much support the fact that MMS is introduced in the context of implementation research in a way that strengthens the entire antenatal care system. So that would include, where needed, the inclusion of figuring out how to deliver all the services or interventions, evidence-based interventions, together in a package that would best support the pregnant women. Marty, I don't know if you have any other comments on that.
Yeah, I heard the question, but not your answer because my internet comes and goes. I'm very, very sorry. And I know, Pat, that you have asked this question before. And yes, I think, yes, we have to look at a basket of interventions, of course, context specific, of course, balanced energy protein is crucial for those women that are undernourished. So I agree with that. And I'm the first to admit that when we set up the Healthy Mothers, Healthy Babies, yes, we had in mind that we wanted to drive the agenda of MMS because of the 20 years of research that was sitting there, heavy evidence, but not yet so much implementation. But we're not stopping there. It's not the only thing, but we can't do everything at the same time. I agree with you, and we will need to make sure that our narrative and our messages are taking into account the entire basket of the interventions, depending on, of course, the target population, their needs, their statistics. There's a lot of other questions while my internet is working. Questions and comments. So Sarah Rowe indicates that there's also IR projects ongoing in Pakistan, where Nutrition International is working with the government. So that is great. I'm looking forward to that communication. And the question of Naveen Podial, I hope I pronounce your name correctly. How much is it is again important to enter into implementation research where countries have already had successful maternal IFA supplementation? Or can you use the lessons from IFA when you want to shift to MMS? That is a question.
Yeah, I think definitely you should use the lessons, especially if they've been successful in the implementation of IFA, which in many places that's not the case. And I think so there's a big push to use implementation research to inform the introduction of MMS because it provides an opportunity to address issues such as poor uptake and adherence, or maybe a delivery system that just is not quite successful. But if you already have the strong landscape and the platform where IFA is being delivered successfully, where uptake is high, the adherence high, the coverage is high, like I think that you're in a really good spot. You just might want to make sure that the transition from one supplement to the other doesn't in any way negate the success you had before. So you might need to do a little to investigate that MMS is going to be accepted by the population. But I think compared to a lot of other places where IFA hasn't been as successful, you're in a very good position.
And if I may add to that, Kristen, I do think that there's a lot of this preparatory work and formative research that can be skipped, but then there might still be a need for formative research on the particular messages, because the messages is different in the sense, not that they have to take it on a daily basis, the women, but also on what, there is an added value to MMS also in taking that. So I think it is important to have some work done on what is the difference in the messages, how are they understood by the women themselves in their environment. Actually linked to this was a question from Hema Divakar. She says also, if we already have evidence, how can we fast track implementation, get the attention from policymakers? Now, if we talk about attention from policymakers, I'm thinking advocacy, and advocacy comes ahead of implementation. So I'm not so sure how to interpret this question, but maybe you do, Kristen.
Yeah, I mean, I think you're right. I think there just has to be a lot of, you still have to create an enabling environment for the switch. So issues of the policy change, which require awareness raising and consensus building, and issues related to making sure the supply is accessible and sustainable and affordable, all those things still have to be done. But I think that, with commitment, there are a lot of countries also that want to fast track this, right? So I think with commitment and just focus, it can be fast tracked. Implementation research in every place doesn't have to be, a 3 or 4 year process, especially if the IFA platform has been successful and other ANC interventions are successful.
Now you mentioned 3-4 years. Here is a question on what should be the duration of implementation research before we come to the conclusion of feasibility coverage. And maybe it's good if you can talk to the duration of the different phases, right? The way you've been saying there's a preparatory phase or an exploratory phase, there's introduction, etc.
Yeah, I mean, I think what we're learning or what seems to be unfolding is probably a 3 or 4 year phase to scale up. So, there is that whole, and again, Marty, like you said, every country is different. So, in some countries, you may not have to spend as much time in that first phase, for example, which is in building the enabling environment, because maybe it's largely built. But in many cases, it's not, and that can take a long period of time. And it will also continue into phase 2 and 3. And then phase 2, which is actually really, the development and testing some of the implementation strategies. Often it's framed within like a pilot, a subpopulation, maybe a representative population of the country at large. And it generally includes, things like formative research. So really kind of asking the stakeholders at different levels, so pregnant women, healthcare providers, health officials, really trying to figure out what might be the barriers and facilitators to introducing MMS. That can take a long time, or it can be fast tracked. And there are rapid assessment methods to fast track it, so you can get it done quickly in a few months. Use the information to then work with the key stakeholders to co-design 1 or 2 or 3 implementation strategies and test it. And again, that probably would take another year. So, and then as long as the stakeholders everybody's engaged and owns the process, and the environment or the enabling environment continues to be built for ensuring, a supply and things like that, then, year 3 or 4, I think the countries can start transitioning into the scale up.
I really like it how you frame that that period of implementation research also is a process for bringing stakeholders on board. So it's not just research being done by researchers and then here are the results and then we go to the people that implement. It's actually a process, and that's why maybe also, though some things can be fast-tracked, the process of adaptation, of making a decision, some things just take time and need time for people to see what are benefits, what are the pros and cons, etc. I see 2 very, very good questions from our colleagues from Nutrition International, related questions. So Sarah is asking, how are others managing implementation research related to MMS in places where anemia prevalence is high, and where actually, severe anemia, where the WHO recommendation suggests a 60 milligram iron product. And related to that, Jennifer is asking, how do you manage that? Let's say, so you want to, MMS is used for prevention, and then you have the treatment of the anemia with a higher dose of iron. Do we then stop the MMS when women are detected with anemia? How have you any experience in this?
They're really good questions, and I will do my best to answer, but I think they still are questions. So if anybody else has thoughts in this area, please chime in. But a lot of some of the experience I've had, this question always comes up in the context of implementation research, actually. And, I think largely what I've seen happen is that women who are, for example, severely anemic, they will be treated for anemia based on the country's policy. And then once their anemia is treated, transition to MMS. On the other hand, I've heard the argument that treatment can happen and MMS can also continue to be given. So they can happen at the same time. So I think it's still something people are trying to figure out what's best. And if anybody else has thoughts, please chime in.
Yeah, I'm looking at hands up, but I don't see any hands up for the moment. Mm-hmm. I don't know, Jennifer or Sarah, do you want to make a comment, or do you have other thoughts about this experience?
Yeah, it's Jenny here from Nutrition International. I think this is when we're looking at implementation research and we're studying the MMS, we also know in many of these countries that anemia prevalence, even entering pregnancy, is very high. And so, the best thing we can do is detect the anemia and treat it. And as you say, Kristen, the protocol in countries usually 120 milligrams of iron, so 2 tablets of IFA, usually they're 60 milligrams each. So I think at this point, as Nutrition Internationally, we need to respect the current protocol for detection and treatment of anemia, and not just severe anemia. The protocol is really all anemia. But it becomes tricky logistically and management once you introduce the MMS and you are increasing that adherence and compliance. Then for her to switch back to IFA for the treatment, which can take 3 months or so, and then switch back to MMS. I think as we move forward as a global community, this is something we need to think carefully about. The logistics of this, and is there a better way to manage the treatment without taking the other micronutrients away from the pregnant woman. But right now, the policy environment doesn't allow that in the countries that we're supporting. Thanks.
Excellent point. And I actually am checking because I thought I saw Megan from the MMS tag, but I can't see her anymore. Megan, if you're there, is the tag taking this question on?
Yeah, so we are trying to look at it in a few ways. One is going back to the clinical trials to see how MMS versus IFA impacts iron-related outcomes, although that doesn't directly answer this question at all as to how do you treat anemia. The tag has been pretty consistent in suggesting that we really need to understand the causes of anemia in a particular location. So that could be really important. And there's a lot of concern around adding extra iron if it's not iron deficiency anemia. But this is definitely a logistical issue that we really need to address to make sure that women are able to benefit from all the micronutrients in MMS as well as iron. So perhaps we should add this to our list of considerations for the tag.
Great point.
Yes, definitely.
Kristen, do you want to make a last comment? We're almost at time.
I guess I thank everybody for joining. I'm glad there's so much interest in the area. Like I said, I think the timing is right, and a lot of groups and people are interested in connecting MMS with pregnant women in the context of strengthening ANC. So it's a really exciting time, and I really appreciated the conversation. So thank you. And thank you, Marty, again for inviting me.
And thank you, Kristen. I thought it was a great session as well. Anybody who likes to know more about MMS, please visit our Knowledge Hub on the Healthy Mothers, Healthy Babies website or write to us. We have a next chat, the last one in this series. here on the 18th of November next week at 8 a.m. I guess that's 8 a.m. Eastern time, 2 p.m. in Europe and 6:30 in India. And that is with Mr. Taslim Uddin Khan, who is a deputy managing director of the social marketing company in Bangladesh. And he will talk to us about the MMS experience in Bangladesh, notably about distribution through local pharmacies. Thank you for today, and we look forward to see you joining us again. Have a great day and a great end of the week. Thanks, Kristen. Bye.
Thanks, Marty. Bye.